Hi, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions about dental cleanings, so I'm here today to answer a few of the most common questions and help to give you a better understanding on this topic. So the first question we get is, what are the main types of dental cleanings? So when it comes to dental cleanings, there's kind of a few depending on the severity of disease that's present in a patient's mouth. Most kind of standard cleaning would be though that we're just doing some scaling because patients have some buildup or some bacteria that's growing on the tops of the teeth above the gums. So we're removing that. Then we get a bit more of the involved where the bacteria has started to grow underneath the gums, and we have to do a bit of cleaning underneath on the root surface and make sure that we get rid of all that bacteria. And then you have your kind of really involved where unfortunately that bacteria has started to do a lot of damage. We now need to refer out to a periodontist, which is a gum specialist, in order for them to do a more surgical cleaning where they have to really get the gums back, really clean out underneath the teeth because now it's so deep that our instruments can't reach there without these surgical techniques and make sure that that disease isn't progressing. So the next question we get is, what happens if my teeth are not cleaned regularly? So what happens when you don't clean your teeth is that bacteria start to grow on the teeth in a biofilm called plaque, which then hardens over time into what's called calculus. So the issue when you don't come in for cleanings is that unfortunately this calculus is going to start to form. No matter how well you brush your teeth, there's always going to be some areas where there's some calculus that forms because the brush can't reach all of the areas. What happens with this is that as the calculus grows, it starts on the top part of the tooth, which is visible in your mouth, but it actually starts to grow underneath the gums down towards the root. So there's a little bit of a gap between the gum tissue that's hugging your tooth, and that's where this bacteria goes. The problem with this is that as the bacteria works its way down, the body really doesn't like this. And what ends up happening is the bone that helps to support your teeth and your roots, it starts to shrink away, which is what we call gum disease. Problem with gum disease is that a lot of the times in the earlier stages, there aren't any symptoms associated with it, and it generally doesn't start to hurt or get infected until it's very severe. The problem with this is that once you lose the bone, unfortunately, there's no way to get it back. So a lot of the times this ends up in teeth that need to be extracted. And also with gum disease, when it's more severe, it can lead to other systemic health issues such as heart disease, diabetes, Alzheimer's. You're at a much higher risk for all of those. As well, there's been a study out of Harvard where you're about 2 to 3 times more likely to have a heart attack or stroke. So very important staying on top of it because the disease can progress quite rapidly. So patients will ask, does regular dental cleanings improve dental health? So the short answer is yes. When we remove this bacteria from your teeth, that's going to allow your gums and the bone around your teeth to stay healthy. When you're combining that with good at-home oral hygiene, so brushing twice a day and flossing once a day, that's going to give you the best chance of keeping your teeth healthy long-term so that we don't have any of these issues like gum disease occur. So patients will ask, how often should I get my teeth cleaned? And this question really depends on the individual patient. So for most of our patients, what's recommended is coming in every 6 months. For other patients, though, who may already have gum disease that's existing, or maybe they have other things going on, like they're in the middle of active orthodontic treatment and they have braces on their teeth, where more regular cleaning is required, we would recommend for those patients that they come in every 3 to 4 months so that we can stay on top of removing the bacteria and preventing those issues from forming. So patients will ask, how do you do a deep cleaning? So generally with the deep cleaning, it's done the same as a normal cleaning, where we use our hand instruments to scale off the bacteria. And then also we use our Cavitron, which is an instrument that uses water and a high frequency in order to break up the bacteria off of the teeth. The one issue when it comes to deeper cleanings is that because generally patients have been in for quite a while and there's a lot of bacteria, the gums are usually quite inflamed, and that makes them more tender and more uncomfortable and painful. So sometimes what we'll do for a deep cleaning, if you're finding it's too uncomfortable, we can give you a bit of freezing to numb up those gums so that we can really get in there and remove all the bacteria. Once we do, and if you're maintaining it at home with good oral hygiene, the inflammation will lessen in your gums. And the next time you come in, you're going to notice that it's going to be much more comfortable to get that cleaning done. So we had asked, do dental cleanings remove tartar? Yes, so tartar is another word for that calculus or that hardened bacteria and minerals that grow on your teeth. So that is the main thing that we're doing when you come in for cleanings, is we're removing that tartar or calculus off of the teeth so that they stay healthy. Patients will ask, will a dental cleaning make my teeth whiter? So yes, they will make your teeth whiter because that bacteria or that calculus that grows on the teeth tends to have kind of a yellowish color. So by removing that off of the teeth, and then after we're done that, we will polish your teeth to remove any of the stains. Your teeth are going to look whiter after the cleaning. For some patients though, they're looking for a very high level of whitening. And that's when we get more into cosmetic treatment where we can discuss whitening so that we can get your teeth as white as they possibly can be. So patients will ask, does a hygienist's teeth cleaning usually hurt? So when you're coming in regularly for cleanings, if you're coming in every 6 months or less, it's very unlikely that cleaning is going to be painful. When it gets painful is when you haven't been in for a while. So when you're, over a year, 2 years, 3 years, now you've had so much bacteria that's formed in your mouth and under the gums that your gums are very inflamed and puffy and tender. And unfortunately, when gums are inflamed, that's when they get painful. So when we have to go underneath and clean it, that can be uncomfortable. We have different options in terms of there's different sprays that we can use or topical freezings, or even we can give you some freezing in order to make the experience more comfortable. But the short answer is if you come in frequently, your cleaning should not be very painful. So patients will ask, how can I go about scheduling a teeth cleaning appointment? So the easiest way would be for you to give us a call at our office, or you could go on our website and fill out a form, and we'll set you up with a cleaning as soon as possible. All right, so I hope I was able to answer some of your questions about dental cleanings. If you do have any further questions, or you are interested in getting a cleaning done for yourself, please feel free to give us a call at 204-817-6768, and we'd be happy to help.